Indian map. Delhi is Indian capital. We live in Ladakh. Ladakh is in Jammu and Kashmir.
Ladakh is a land of ancient traditions. Tucked into the high Himalaya of northwest India, much of the region remains roadless even today. The rugged landscape acts as a formidable obstacle to human habitation, yet the resilient Ladakhi culture maintains its tenuous existence much as it has for centuries. That said, life here is anything but easy. In the villages, anemia affects most women, and their illiteracy rates are nearly 100%. Villagers want to improve their health and welfare, but simply lack resources and information to effect changes.
I first came to India 20 years ago as a mountaineer and fell in love with the people in the place and have stayed really ever since. We first started in 1989 with Health Inc. and the name means Health, Environment and Literacy in the Himalayas, and Inc. actually stands for in cooperation with the local people. Here in South Asia, what is commonly called the underdeveloped part of the world, what I see is really important in grassroots development is investing in health and education. If you invest in just those two areas, you give people access to what they need to change everything else in their lives themselves.
Cynthia Hunt's NGO, which is a non-governmental organization, up in Ladakh is one that we really wanted to support. I had met her personally, another member of our small society had met her, and we were just so impressed with what she was doing. We know that for a minimal amount of money we'll get the maximum benefit. We know it'll be well spent, that the effort that she goes to document everything that she's doing is meticulously done. And she's not only an impressive lady, but the projects that she's doing are very worthwhile.
All of our projects start first in the village and come to us. We never go to the village with a project idea. And in fact, when we first come out to a village, the first thing the villagers have to do is we all collect together, every single person, 400 people in a village, 50 people in a village, it doesn't matter. We all have to come together and sign an agreement for a 3-year work plan. If anybody in the village disagrees with anything that's in that 3-year plan, knowing that they have to do 90% of the work, we won't come back to that village. It simply is not sustainable, and in the long term, it doesn't do the real kind of self-help work that we're interested in doing.
Before we built the greenhouse, we couldn't grow many different vegetables. Now, we grow so many things for our children, like cabbage, cauliflower, and even tomatoes.
The 2 interns who are in our program now are typical of all the interns that we have. Sonam Norbu is from a remote village in Nubra, and he's actually on loan to us from the Department of Health as a medical assistant. Punsak Stanzin comes from the Changtang. He's from a nomad family right up against the border in far eastern Ladakh. When we talk about investing in the future, people like Stanzin and Norbu are absolutely vital to that. These kids come from disadvantaged homes in the remote villages.
I have been working with this Health Inc. project since last 2 years, and one of the most important part of this project is to develop teaching materials for the remote villages schools in Ladakh, and the book should be relevant to our environment as well as culture of Ladakh.
This job is very difficult for us, even for Ladakhi, because we are working in the most difficult area of Ladakh. And for instance, yesterday, the pass behind us, we started in the morning at 8 o'clock, and after 5 hours working, we came down to the 1,000 meter down. After that, after crossing the Indus River, we again, went up to the village, and there we worked for 3 hours with the villager on nutrition, and also we did some survey on education also.
It's very easy for us Westerners to forget about access to information. We are inundated with information. We are overwhelmed by it. But in this part of the world, in the Himalayas, there are many places that don't have any access whatsoever to information. And here in Ladakh, it's really a big issue, and it has really been detrimental to development aid. If Ladakhis are to come into this century with any chance at all, it will be tied to that idea of access to information. And we went out and did the research and found out that an awful lot of the village kids knew nothing about hygiene or sanitation or the important issues in a child's life. In fact, 50% of the deaths here in India and over 3 million people in the world die every year simply from dirty hands and lack of access to safe drinking water. The research showed us that children need to know more about hygiene, sanitation, nutrition, and oral health, and nothing was done in the local language. We created Padma as a character because we wanted her to be heroic in the children's eyes here. We wanted her to be clever and get out of tough situations and do things that really made sense in their day-to-day life. Everybody knows who Padma is now. In one of our books, Padma and the Plaques, we created this character, this naughty little bootsy. And Padma, with the help of the ITBP, the India Toothbrush Police, beat up the bootsy and win the day. Down and up. Oh, very good. Very good. Okay. This part of the work has actually been a really interesting challenge. I'd never drawn before 5 years ago. And unfortunately, one of the things that happened was that our artist died right before we had a big deadline for getting out one of our books. And so I had to just do the drawing myself and send it off. But one of the things that's nice is that I've found over the years I really enjoy doing this work, and it's grown on me, and it's been a really nice connection with the children. The story is just meant to entertain the children and to really grab their attention. But an awful lot of health support material has to go out along with that storybook. By the time we finish, we also need teachers' guides to help the teachers to teach the books. We need medical assistant guides that teach them the fundamentals behind the lesson. And we need posters and stickers for the children, games. Sometimes they play hygiene snakes and ladders. And all of that material is a part of one single book that we produce. One thing that could easily be forgotten is that our teachers at most